Hey, Dr. Here. Just wanted to highlight some of the changes that can happen in the lower eyelid in some younger patients. I saw a patient this morning who beautifully demonstrates these changes, and so I wanted to use her picture as a way to kind of explain what happens in the lower eyelid in younger patients sometimes and how we can approach them. So as you can see, she has this area that's sort of like discolored on the inside corner of her lower eyelid. Essentially what's happening there is all of us, everyone has fat in the inside of the lower eyelid, kind of in the inside the eye socket. And there's a membrane that's supposed to hold this fat back. Over time, or for genetic reasons like in this patient, that membrane can get loose and the fat can start to come forward and form a bulge in this area. And that bulge is often discolored a little bit red. And the reason why is the layers here go skin, muscle, septum, which is the membrane that's supposed to hold the fat back, and then fat. If you inherit a loose orbital septum or a loose membrane, that fat starts to bulge forward and it pushes the muscle into the skin, which can make the skin look a little bit red. Now, if we can relieve that push, we can relieve that discoloration. Older techniques would make an incision along the lower eyelid lash line, full thickness through the eyelid, and suck all the fat out. Well, that can lead to scarring, eyelid position problems, and hollowness. So instead, what we do is we make a hidden incision on the back side of the eyelid, remove some of the fat, but usually I reposition the vast majority of it to fill in the valley that's beneath the bag. And it's interesting, patients often come to me complaining of hollowness, or some will complain of puffiness or bulging, and really it's often both. There's a bulge that's often discolored, and beneath that bulge is an area that's hollow. So I make a hidden incision on the back side of the eyelid, reposition some fat to fill in the valley, and then I usually do something to tighten the skin. Chemical peels are one of my favorite things to do, and I'll make another post about why I love chemical peels so much. I hope that helps.